Hello guys, welcome back, and today we are going to discuss about a model called Gibbs reflective model. Gibbs reflective model is one of the very useful model which you can use in healthcare setup or education setup to analyze yourself. Okay, so it enables the individual to think systematically about the experiences they had during a specific situation, like working in a specific situation, working with a group of team, etc. Okay, there are different types of models. We have like Gibbs model, Jones models, Cron models, Atkins and Murphy model of reflections, etc. And this video we are going to discuss, or I'm going to show how this Gibbs model will work. So what is this Gibbs model? Okay, Gibbs reflective cycle is developed by Graham Gibbs in 1988 at Oxford Polytechnic and now Oxford Brookes University. This reflective cycle framework is widely used within various fields such as healthcare, education, etc. So, Gibbs reflective cycle is a type of reflective model where we can use, means especially in healthcare and education setup, to analyze our capacity, to analyze ourselves, to analyze our need to improve ourselves, to know who you are. This cycle consists of 6 stages: description, feeling, evaluation, analysis, conclusion, and action plan. So, description means what happened. Okay. So, in this stage, you need to describe your experiences, where you have appointed or where you are working. Description. Second stage is feeling. In feeling stage, you have to talk about what were you thinking and feeling. What were you thinking and feeling about the particular work or particular situation. The third is evaluation. In evaluation, you have to do an evaluation on what knowledge you have obtained from the process and what we need to change. Next is analyze. In analysis stage, you have to do a judgment and you have to check the challenges. Okay, and what else can you do or can you make of the situations to improve. Then next stage is conclusion. In conclusion, you have to think about the process. What else could you have done to improve and to continue to develop yourself, etc. Then last is action plan. That means what's next, right? That is the plan to improve yourself, to come up with a plan for how to approach similar experiences in future. So basically, this gift reflective cycle will prepare you to face new challenges. Okay, this Gibbs model is a very good way to work through an experience. As I said, first stage is what? Description. Okay, apply this Gibbs model in a hospital, and when you imagine you are working in a hospital and you want to write a reflection about your work experience based on Gibbs model, means how you will apply Gibbs model, that you will see here. Okay, first stage is description, right? So in description, right, what you're writing, you are writing the pure facts about the particular situation. The first step is to describe what you know about the place. Place means what? Hospital. That means the hospital or ward where you are working, and ask yourself the following questions, like what are the brief facts about hospital or description of the hospital or the place or the specific ward where you're working. Second question is what occurred. That means what is your job role there and what about your patient. Okay, that question you have to answer in the description stage. Then also need to do a short description about Gibbs model. Next is stage 2, feeling. In feeling stage, you have to ask these questions. First one is, how is or was your feeling while working with your patient and hospital and team? Then, did their behavior affected you, and in which way it affected you? Did you receive any difficulties or problems during the time of procedures, or related to time, or related to place, or related to information or resources, etc.? So here you are writing your feeling. Then next is evaluation. In evaluation, you have to ask these questions. What was good and bad about the experience from the hospital during our work? Both from the patient and team you have to write. Then how might these facts and feelings have affected your action? What other circumstances, like other circumstances, other people you have noticed, and other working pattern, other people's attitude you have noticed, other people's competition which you have noticed while working, and how these issues influence the activity or work or duty which you have done. Next is stage 4, that is analysis. In analysis, what you have to do, you have to analyze your likes, analyze your dislikes, analyze what you have experienced, analyze everything from the starting till date based on the description, based on the evaluation. Okay, then analyze also the main area of concern, focus while working in future. Then you can do to conclusion. In conclusion, you have to ask this question to you: what have you discovered or identified while working in a specific ward or in a specific hospital with a specific team? What you have learned from the particular incident? If any incident happened, what you have learned from the incident? How was the whole day working? Everything. Then what questions remain you have? You must have some questions. Then only you can go to the last stage, that is planning stage. There, what you're doing, you are doing an action. What is next? Here you have analyzed the incident and want to make sure you improve your practice for the next time. And what resources will you need to improve yourself, to improve the situation, to improve the experiences when you're going to work in the same type of situations. Now I'll give some more detailed example and description here. Okay, so first thing is description. That is the first stage, right? In description, imagine you're working, you're a health and social care student or nursing student or a pharmacy student, and you got a chance to work in a care home as a part of your placement. Okay, so you don't have much experiences in that field. Imagine like that. Okay, so how you will write the description means just a brief description I'm giving here. I'm a health and social care student, and I got a chance to work in a care home as a part of my placement. Basically, my duty was to assist carer in personal care and feeding of patients. I checked with carers regarding the process because I'm quite new. While assisting them, I have fully observed and assisted my team members without losing my concentration. Okay, so like, and also you can write about the care home where you have worked, or in pharmacy, or the healthcare setup, or the school or college, or wherever. Okay, then next stage is what? Feeling. In feeling, what you are writing your feelings, right? You can write like, it was a very busy care home with many service users with less staff and all need good observation. I was nervous. That is your feeling about the work. The carer and nurse was under tremendous busy. That is your feeling about their situation. And the team leader was rushing about all over the place. I had never seen this type of situation before. The nurse and some carers were new there. So whatever the things you felt about you and about the people, those who worked along with you, that you can write there. Then evaluation. Nobody ever blamed and shouted through there is too much or though there is too much rush. So throughout, nobody blamed or shouted each other, though there is too much rush. I felt absolutely tired at one point due to the busy schedule. I didn't sleep at all during my night shift day. So evaluation, like, I'm tired. I couldn't concentrate much. Okay. But still I observed that nobody ever blamed each other. That is an evaluation. Then analysis. So in analysis stage, what you can write, one patient died during my shift. So any specific point you can pick out, okay, what you have observed. One patient died during my shift, and that really frightened me. So I have decided to become more serious. And also I realized that how dependent I am on others. Also, I need to maintain conversation about everything with the team. So you are doing an analysis there. Okay. Then conclusion. I have completed my duty successfully and I've learned many things during this days period. And I need to do these type of improvement. Then action. That means what? What next? I've learned to be more careful and to really understand. If necessary, now I will look up each procedure, including training, because it is my responsibility. If I do it wrong, it will affect everyone. So it is my responsibility to learn everything. So that is your action. You are going to participate in the training. You're going to participate in programs which enrich your knowledge. And I will always be ultra careful with new in future. And if I'm nervous, then to go to my gut feeling and check and talk and also learn to get good support. So in action plan, what you're going to plan to improve yourself, to improve your confidence, to improve your independence. Okay, it depends. So like this, you have to apply Gibbs model or Gibbs reflective model. Okay, so this Gibbs reflective model will basically support you to improve yourself. Okay, if you're working in the same type of place again and again, how you can improve yourself through this Gibbs model, you can analyze yourself. Hope you understand, guys. Thank you.